Hello, I'm Tony. I'm a physical therapist over at Baptist Rehab, and I'm Tammy's husband, and she has asked me to go over cranial nerves for you. And so I thought I'd share just a couple of little memory tricks and try to explain kind of what they are. We're not going to go into really deep detail because there's just no reason for you to know every piece of anatomy on that, but just some of the basic stuff about what cranial nerves are and what each of the 12 cranial nerves are. So basically, cranial nerves are nerves that come directly off of the brain and go out into the body and supply different things. They're different from peripheral nerves, which come off you've got the brain and the spinal cord, which is considered your central nervous system. And then off of the spinal cord, you have nerves that come off at every level that go down into your arms, legs, and trunk. Those are peripheral nerves. The cranial nerves come directly off of the brain stem and the deepest, oldest part of the brain. And generally, they're responsible for, function, basic life functions that you need. Some of them are sensory, some of them are motor, and some of them are both. Cranial nerves, if you sever a peripheral nerve, it can grow back. It grows back about an inch a month or about a millimeter a day. So it can grow back. A cranial nerve, if you sever a cranial nerve, the nerve is, like I said, it comes directly off the brain and it can't regenerate itself. So for example, if you cut your optic nerve, it's not going to grow back on that. That's a permanent injury. And so to start with, the first cranial nerve is called the olfactory nerve. The way that I remember that, it's the first cranial nerve, and olfactory deals with smell. And so if I think of, if I'm looking at my face, I've got one finger for the first cranial nerve, and I have one nose. And so that's the cranial nerve. Number one has to do with your nose, which is for smelling. And if you think of when you walk into like a tire factory, it smells bad. That's kind of the way that I remember it, is olfactory. Number two is the optic nerve. So cranial nerve number two, I have two eyes. And that's, remember, you think of optics as opsia means vision, or pertaining to vision. And so optometrists, those are all dealing with vision. So cranial nerve number two is the optic nerve. Cranial nerve number three is called the ocular motor nerve. Now, cranial nerve number 3, 4, and 6 all have to do with the movement of the eyeballs on that. And that's primarily what they're for. They do, like the ocular motor, it helps to control the lens and the pupil dilating. So, I mean, it's everything to do with moving the eyeball on there. And so the ocular motor, like I said, it's the third cranial nerve. There are some of them that you just kind of have to memorize. It's not that hard, but like I said, 3, 4, and 6 have to do with the eyeball movements. Oculomotor, since we know that it has to deal with the movement of the eyeballs, then they kind of make sense. Ocular is the vision and the motor is the movement of it. Trochlear, basically it pulls the eyeballs up and diagonally is what it has to do with. The way that I kind of remember that, and it doesn't even make sense, but it's almost like a pulley is kind of the way that it works. And so that's just kind of one of those that I just memorize. Abducens is the sixth cranial nerve number 6. Here's the way that I remember that. If I have eyes like that, and if I were to draw a 6 around that eye, it looks like that looks like an eyebrow wrapping around the eye, and it's pointed that way. If you think of the word abduct, like that also has to do with anatomical terms, like my shoulder. I abduct my shoulder. The ABD, abd, means to take away. And so the movement of the abducens is it moves it outward. So so if I want to look left, the abducens muscle, the abducens muscle and the abducens nerve is going to pull my eyeball away from midline. So it abducts it from midline. And so I just remember the 6 like that, and it's kind of pointed away from midline on there. The 5th cranial nerve is the trigeminal nerve, and the trigeminal nerve is primarily sensory, and it's sensory to the face. So the way, and I saw this trick recently and I liked it. The way that you remember that is, say I've got five fingers on there, and say I'm starting to sweat, and so I'm wiping my face down like that because if you think of the trigeminal nerve, it's actually 3 nerves. There's one up here on the forehead, one up here on the maxilla, and one up here on the mandible. Don't worry about the names of the branches of those nerves, because that probably isn't going to be as important. But the trigeminal nerve is 3 different branches that supply the sensory of the face. So just you're wiping your face off with 5 fingers. Cranial nerve number 5 is the trigeminal nerve. The geminal, you just kind of have to remember. Trigeminal. We had talked about the 6 is the abducens. The 7th cranial nerve is the facial nerve. The facial nerve supplies all of the motor of the face. Okay, so if you think face, facial movements on that. The way that I remember that is, so if I have, oh, that's not dry erase, is it? Okay, well, anyway, if I have eyeballs in here, and if I draw a 7 for the eyebrow and the nose, then that's my face right there. So that's kind of how I remember facial nerve is, think of the eyebrow coming across, and it comes across the face. And that does all the movements, all the muscles of motor expression is what that's for. It also does like tear ducts and some other things that you don't have to worry about. But like I said, primarily it's moving the face. The vestibular cochlear nerve is the cranial nerve number 8. And the way that I remember that is, I think of Mickey Mouse. So up here I think of Mickey Mouse, and his big Mickey ears makes an 8 on there. Okay. If you think of as far as vestibular cochlear, the vestibular part, they talk about, I've got my inner ears thrown off and it makes me dizzy. That's what the vestibular nerve does, is it sends a signal to the brain. There are different tubes inside of the ear that are filled with fluid that level your head, and that level is in both ears, and that nerve impulse sends that signal to the brain to coordinate with the neck and everything else to keep your head upright, tell your brain what straight up and down is. The cochlear part is the hearing part of it. And if you look at it anatomically, it looks like a little snail's shell on there. And it's filled with these little filaments that respond to different vibrations, different frequencies of vibration. And so that's why some people, as people get older, they have trouble hearing higher pitched voices, is because those are some of the first of those nerve endings to fail on that. As far as remembering cochlear, I just think cochlear implant. That's what that's for, is cochlear implant is so they can hear. So it's the vestibular is the inner ear part. Vestibular cochlear nerve is cranial nerve number 8. The cranial nerve number 9 is called the glossopharyngeal nerve. The way that I remember that, the glottis it refers to tongue. And so the glossopharyngeal nerve is basically the pharynx. It's the back of the throat and the back of the tongue, and it's sensory primarily. The way that I remember that is I'll make a 9 with my finger like that, with my finger and thumb, and it's like I'm gagging myself. So you would tickle the back of your throat or your pharynx with that. So that's cranial nerve number 9, and I'm reaching back to tickle the back of my throat, which is the pharynx, making myself gag. Okay, and that's the glossopharyngeal nerve, cranial nerve number 9. Cranial nerve number 10 is the vagus nerve. The vagus nerve supplies basically all of this below the neck, and it supplies your heart. It responds to blood pressure, your breathing, just all of these things, that your digestive organs, and it feeds all of those. The way that I remember that is, you think of its cranial nerve number 10 as the vagus nerve, and I think like I'm going to Las Vegas and betting $10 on that, and once it starts once the bet's placed, my heart starts racing on that, because I get really excited because I'm in Vegas. And so that's that's kind of the way that I remember it. It's all down in here. It's the vagus nerve on that. Cranial nerve number 11 is called the accessory nerve. The accessory nerve is a motor nerve that supplies these two muscles here and your upper traps. So it's these two muscles in here called the sternocleidomastoid, and these two muscles in here of the upper traps. So the way that I remember as far as the number on that, number 1, if you point to there, it looks like 11. So I've got 11 coming right across here, or if I shrug, it's up, down, up, down. Okay, so that's cranial nerve number 11. And if you think of the accessory nerve, think of it like you carry a backpack over your shoulder. The straps come down like that, and you carry a bunch of accessories in your backpack. Okay, the cranial nerve number 12 is called the hypoglossal nerve, and that is the movement of the tongue. It supplies the movement of the tongue. Remember, again, glossal means tongue, literally means tongue. Hypo means below. So hypothermia means your temperature is below normal. And so it's, it literally means kind of below the tongue. But it's the nerve that supplies the motor of the tongue. So that's about it. I hope this helps. Good luck.